Okay, guys, now that we've looked at the specific and non-specific sides of the immune system, let's take a look at a few disorders that we might have to do with the immune system. One of them we can talk about is immunodeficiencies. So basically we're saying the immune system's not working well enough, right? And then we're going to turn our attention to an overactive immunity, or an immune system that is attacking the wrong thing, all right? So immunodeficiencies we can kind of break down into two major categories. If we want to, we can look at the primary immunodeficiency classification, and that would basically mean you're lacking immune cells, all right? There are conditions where folks literally lack B cells. So they don't have the identification of foreign antigens and then antibody production as a result. Or you might find that there are lacking T cells or complete absence of T cells. These are major disorders, okay? Sometimes you will run into something called SCID, which is a severe combined immunodeficiency, and this would be a combination of both, all right, where you don't have the normal quantity of B cells and you're lacking for the T cells. And this can be serious and fatal if you're not isolated from others and from pathogens that might cause disease, because you have really not much of a specific side at all when it comes to B cells and T cells. The fact that they're lacking is going to leave you wide open to infections. And a big thing that I may have neglected to mention when we're talking about T cells is that without T cells, you cannot orchestrate an efficient attack, right? Remember, those helper T cells also communicate with the non-specific phagocytes and so on, and really they really increase the efficiency of the immune system. Now, usually what we're talking about secondary classification, where there's a loss of immune response due to some other cause, right? Or a disease process that's in place. And this could relate to age. It's normal for immunity to wane in its ability as you grow older. Literally, the thymus gets smaller after adolescence. It just continually gets smaller, right? Diet can play a role. It's been shown that certain vitamins are really important to normal immune function. In fact, more recently with the coronavirus business, they're finding out that vitamin D really could help you to fend off the virus and help your immune system out in that way. So check out, go and get some vitamin D. There's medical treatments that could cause immunodeficiencies. Any kind of drug that decreases cell division can reduce immunity. Keep in mind, B cells and T cells are blood cells, and if we toss in a drug, like maybe a chemo drug, that reduces cell division in the bone marrow, you're going to have fewer of those cells. And that could leave you open to infection. In fact, a lot of the biological anti-inflammatories also bring down your normal immunity, because they could affect anything from your inflammation process, which is a normal step to healing. They could affect these B cells and T cells. So drugs like Humira, Enbrel, Celebrex, these are all kinds of drugs that do interfere with normal immune function. And then, of course, HIV and AIDS. So HIV is the direct attack on helper T cells. Okay, so these would all be some pretty good examples of what usually leads to immunodeficiency. Now, on the flip side, going away from, okay, the immune system's not working well enough, now we move to the other side where the immune system is erroneously attacking cells of your own because it misrecognizes antigens as being foreign. Okay, it's identifying antigens that are normal as foreign, right? So examples are listed here. So multiple sclerosis, we're attacking the myelin sheaths, the cells that make up the myelin sheaths around nerve fibers. Myasthenia gravis, antibodies are produced against your own acetylcholine receptors for skeletal muscles. Graves' disease, antibodies are going after the thyroid, certain proteins on the thyroid. Type 1 diabetes, antibodies are knocking out the beta cells, the pancreas cells that make insulin. And of course, rheumatoid arthritis, where literally the certain cells of the synovial joints have proteins that antibodies are made to destroy. Now, of all of these, Graves' disease is kind of interesting because not only is there an antibody attachment to the various cells, you see that in all of these. Typically, what this means is if there's an antibody attached, then bacteria are going to, it's tagged for destruction, right? These macrophages or other phagocytes are going to come along and do damage. Okay, that's the main problem in most of these. But Graves' disease is interesting because what the antibodies attach to are receptors on the thyroid cells that actually stimulate the thyroid to act faster and produce more product. So it's not just, the worry that you might destroy the cells of the thyroid, but you're actually stimulating the thyroid at first. And this really throws a lot of the hormones in your body out of whack. But usually, most of these, it's the worry is that you are going to do damage to those particular structures because they're targeted by your own immune system. Now, also kind of along the lines of an autoimmunity, but not quite, is hypersensitivity disorders. So here we have a normal response to foreign antigens. So in that way, it's not an autoimmunity situation, right? You're not producing antibodies against your own antigens. You're producing antibodies against foreign antigens, just like the immune system is supposed to do. However, you're producing antibodies against antigens that could do no harm, that don't replicate. They're not bacteria, they're not viruses, they're not toxins produced by bacteria. So in this case, with allergies, antibodies are produced against mundane structures that just look different to the immune system. They're not self-antigens, and therefore there are antibodies and an immune reaction mounted against them, okay? So the first one that we should know about is type 1. Type 1, otherwise known as acute or IgE-mediated. Here, a primary exposure, people are typically fine. Second exposure is typically much more severe. This makes sense if you think about normal primary and secondary exposures. We expect more antibodies to be produced in response to a secondary exposure. And it just gets more, and it just goes up from there, right? When you go third and fourth exposures. Now, when these responses, these kinds of allergies are involved, we worry about something called anaphylaxis. This is one of the common results of someone that has this type of acute hypersensitivity, okay? So we're going to have a whole slide just about this. We're going to talk about this a little bit more in a second, right? What kinds of things could trigger this kind of acute or IgE-mediated response. We also have subacute, type 2, and type 3 categories for hypersensitivities. Type 2 are otherwise known as tissue-specific hypersensitivities. A good example of this would be a bad transfusion where someone who is Rh negative and has antibodies against the Rh factor receive positive blood. They would have antibodies that would attack a specific tissue, in this case, the blood cells being donated. All right. Type 3 is otherwise known as immune complex hypersensitivities. A common example here, and this is where antigens and antibodies become the problem, and a good example here would be strep infections. Folks who have strep throat, recurring strep throat issues when they're young will produce antibodies against strep antigens. And these antibodies and antigens will clump up in the bloodstream, and sometimes they will find their way to the filters of your kidneys, right? The glomeruli, they are called, of your kidneys. And there what will happen is they'll get stuck in that filter, okay? Now, the initial problem in this case will be that this will actually kind of gum up that filter, okay? There won't be adequate filtering of the blood there. But then later what can happen is macrophages come on the scene and start to clear out those complexes, those antigen-antibody complexes, and do damage to the filter. And now you're filtering out things out of the blood that you should not be filtering, okay? And so there you have a connection to microbiology right there with strep infections. Okay, the last type of hypersensitivity disorder would be type 4, and this is also known as cell-mediated or delayed hypersensitivities. And these can take hours to days for them to crop up, and oftentimes you're going to have a special kind of T cell involved with this kind of thing. They're called delayed hypersensitivity T cells. Now, examples where you'd run into this might be if you run into poison ivy, animal dander, okay? So basically just skin that's sloughing off from the surface of the skin from animals, detergents and cosmetics on the skin, let's see, household industrial products, deodorants, so certain metals that are found in deodorants can cause this issue, and metals in jewelry. So my sister-in-law has problems with nickel, right? Nickel in her cell phone, was causing her hands to break out. And ultimately, she even got rid of her regular silverware because her silverware had nickel in it, right? So this is another fourth type we might run into. All right, so just to wrap up our hypersensitivities here, our allergies, let's look at this anaphylaxis. This is the problem that can occur as a result of a type 1 hypersensitivity. And what we worry about is the allergen. So this is just a fancy word for antigen, right? So an antigen could be on a bacterium, and then we should do something about it. But in this case, the antigen is an allergen, just a unique shape on something like pollen, right? Or on like a peanut molecule or something like that. Not something we should really mount an immune response against, but we do, and the immune response is what sends us reeling. So think of an allergen in the blood. An allergen that has access to the blood is an antigen that could go everywhere, right? The bloodstream is throughout the system, so systemic for sure. And it will therefore have the ability to carry the allergen, this antigen that is deemed foreign, throughout the body. So imagine a bee sting. Or penicillin, maybe. A person is recognizing penicillin as a foreign entity in the bloodstream. Now remember, not all people's immune systems will have the same response to all foreign antigens. For some, the immunogenicity, right, the amount of immune response that an antigen will cause will be great, huge, right? And some it will be really not much at all. But usually in this case, you're going to have the spike of this particular allergen in the bloodstream. And what this will cause is, obviously, one of the first things is nonspecific response and inflammation. Okay? So histamine will be released. We'll have vasodilation of our capillaries. These capillaries will get leaky, right? And there will be fluids leaking from the bloodstream in those regions. But in this case, it's not just one localized region. It's everywhere, right? We have this allergen throughout the system. So this means widespread vasodilation, not just, like you get punched in a bar fight and you just have swelling in that one place. Here, it's going to happen throughout the body, and this is going to be cause for widespread loss of fluids. Now, it may not be fluids you're leaking from the body, right? These fluids are going from bloodstream to tissues. That's where the loss is occurring. This means the blood pressure will go down dramatically because fluids are no longer in those pipes, right? In those blood vessels. And this means there will be a shock, a circulatory shock called anaphylaxis, okay? Unfortunately, paired with this is often a bronchoconstriction. So this is kind of a double whammy, right? Not only are you not properly circulating fluids to all these tissues, the blood pressure is not going to be pushing things out to the tissues like you need, but you're going to have constriction of the airways. So oxygen won't be able to get into the bloodstream because of that. Typically, we are going to work on the sympathetic autonomic nervous system with drugs when this happens. We would administer something like epinephrine, natural form being adrenaline, right? Which would cause a sympathetic response to turn this all around, right? We would have, by treating it in this way, a vasoconstriction, get the pressures back up, and a bronchodilation to help you to continue breathing. All right. Now, before we leave this slide and finish this clip, here are some other things that could be deemed as an allergen and cause anaphylaxis. Any toxin that makes its way into that bloodstream could trigger this very same process. Any LPS molecule that you blast off of E. coli, that outer membrane, because you treated it with a bactericidal antibiotic, could cause this kind of reaction. All right? If the bacterium itself makes its way to the bloodstream, it could cause this major reaction. So anaphylaxis could be the response, and what your patient is suffering from if any foreign entity, whether it be an allergen or whether it be some molecule off the surface of bacterium or a toxin or something, make its way there. Okay? All right, so we'll call it quits. We'll jump into some of the crazy ways that these bacteria make their way around our immune system. All right?